Earlier today, WRHA leadership met with our leaders across the system and shared with them a plan to heal our healthcare system.
Our healthcare system is currently broken. People are waiting too long in emergency rooms. They're waiting too long for tests. They're moving around the system, the healthcare system, too much when they shouldn't have to. It's not the care that Manitobans deserve.
So when the Manitoba government gave us a mandate to improve, we embraced it. We asked the staff to take a deep, hard look at our current system and identify ways that we could make the system better for the people who rely on us. After months of hard work, I'm pleased to say that the WRHA board unanimously approved a plan that does just that.
Today, we are announcing a number of changes that we are confident will improve patient care, will ensure that we're providing the right care at the right time in the right place for our patients. The changes we're going to announce are significant. They require changes in the roles of the 6 hospitals and 3 health centers. We will be consolidating acute care and emergency departments in 3 hospitals. Our other hospitals will be centers that focus on elder care, mental health, day surgery, and other services. Our home care services will be enhanced and focused on the goal of keeping our seniors at home and active as long as possible. I'm very proud of the concept of these changes and the design of this plan, which was done by doctors, nurses, clinicians, and other experts both in our system and outside of it. They know best what we need to do, and they know best what quality healthcare looks like.
We will have 3 acute care hospitals with full service emergency departments, and we will have 2 urgent care centers located in Winnipeg. The 3 emergency departments will be at Health Science Centre, St. Boniface Hospital, and the Grace Hospital. The urgent care centers will be located at Victoria Hospital and Seven Oaks Hospital. I said that an important part of our plan today is really around improving care for the elderly in our population. It will rely on enhancing home care services to improve their ability to respond to the changing needs of people in their homes. We will better support those people and their families so that they can be safe and as independent as possible in the community for as long as possible.
I think for a long time, people within the system have recognized that what we're doing isn't really giving us the opportunity to provide optimal care. We're too dispersed, and this really gives us a chance to bring everything together in a way that makes a lot more sense for patients and their families.
As the Chief Medical Officer for quite a number of years now, I have the privilege of talking to new physicians who come into our community. And it's remarkable to me that they're somewhat shocked at the number of acute care hospitals we have in Winnipeg. And many of these physicians are coming from cities that are much, much larger than Winnipeg and yet have fewer acute care hospitals. And that's something I think this system has always had a difficult time understanding. For many, many years, there's been a desire in this community to retain all of these acute care hospitals in their current format, be hospitals that can provide all the services possible to their local communities. But it's simply not a sustainable model. It's not sustainable, and it's not a money issue. The reality is that we will never be able to recruit and retain enough specialists to provide the critical mass of specialists that we would need at 6 acute care hospitals to have a viable emergency department, critical care, to be able to provide that consultation in a timely enough manner to have efficient flow. I would challenge the media to challenge those who are questioning this model to say, what's the alternative?
The access to emergency services has completely changed in the last generation. It used to be that there was a concept of a community hospital that would serve the community, that would have all services and be able to look after most medical needs. Medicine has evolved and become so complex that in fact for patients with a major heart attack or a stroke or trauma or a gastrointestinal bleed or any number of major medical emergencies, those folks have to go to where the specialists and specialized procedures are, and they are generally in a very few centers. So what's happening now is people with major medical emergencies are going to their local emergency department and enduring delays because of the absence of those folks and the procedures. The urgent care centers will be able to look after probably 85 up to 90% of the more minor medical emergencies that normally present to an emergency department, but the 10 or 15% of emergencies that are really life-threatening are best served in centers of excellence.
The Winnipeg Fire Paramedic Service absolutely supports this plan because it really capitalizes on the success of what we already do in terms of specialization of facilities.
Bien, je pense c'est certain que le statu quo ne marche plus, ça c'est évident. Le plan semble se reposer sur l'expérience du patient, alors l'améliorer. Elle repose sur aussi la question d'efficacité. Elle se repose sur des données probantes qui semblent pousser les stratégies. Dans le fond, d'après moi, ça pourrait augurer bien non seulement pour les patients et leurs familles, mais pour les contribuables aussi.
The report is really about doing things differently and doing them better. I think it's fair to say that healthcare systems across this country really need to distance themselves from the concept that better means more. Doing things differently and doing things in a logical fashion will in fact be based on evidence and give you the best practices.